Testosterone replacement therapy. This is a case of a generally healthy 61-year-old married man. His medical history is notable only for gastroesophageal reflux disease and mild lipidemia. His current medications include a proton pump inhibitor and anesthetic. He stopped smoking years ago and gets most of his exercise from recreational tennis. He reports consuming a glass or two of wine several nights a week. He mentions an interest in receiving a prescription for testosterone. Physical examination find no abnormalities of the prostate of testes. Martin's blood pressure is 140 to 75 milligrams Hg. His body mass index is 31.5. In the laboratory results, normal values for fasting serum glucose, hematocrit, and thyroid function. The lipid profile shows a high-density lipoprotein HDL level of 45 milligrams per deciliter, low-density lipoprotein LDL cholesterol level of 85 milligrams per deciliter, triglycerides level of 120 milligrams per deciliter. His total serum testosterone level is 2075 nanograms per deciliter. The repeat test shows a total testosterone level of 2085 nanograms.
Your doctor may recommend testosterone replacement therapy if the level of testosterone in your bloodstream is significantly lower than normal. Testosterone is a male hormone, also called an androgen, which is produced in your testicles. Testosterone promotes the development of male sexual characteristics and supports masculine functions, such as sperm production and sexual desire. This hormone is also essential for maintaining bone density, red blood cell level, muscle mass, and a sense of well-being. Low levels of testosterone in your blood may result in a condition called androgen deficiency or hypogonadism, which may include increased body fat, reduced muscle size, and swollen breasts. If your testosterone level is low, you may experience reduced sex drive, erectile dysfunction, and low sperm count, leading to infertility. A deficiency in testosterone affects all parts of your body and may also cause loss of body hair, increased body fat, decreased muscle mass, diminished bone density, which can lead to osteoporosis, mild anemia, swollen or tender breasts, hot flashes, decreased energy, and depression. Testosterone replacement therapy is the administration of man-made testosterone to raise the level of this hormone in your blood back to normal and to relieve your symptoms. You can take testosterone therapy via an injection, patch, gel, or tablet. If you have injections, you will receive one every 2 to 3 weeks. The testosterone will be delivered into the muscle of your buttocks. If you use a testosterone skin patch, you will place a patch on your arm, back, abdomen, or upper buttocks. You will change the patch daily. If you use testosterone gel, you will apply it daily to the skin on your shoulder, upper arm, or abdomen. If you use buccal tablets, you will place one tablet on your gum line twice a day.
The treatment options there are two treatment options. Recommend testosterone replacement therapy, and the two recommend against testosterone replacement therapy.
We talk about menopause very frequently in our society, but men also undergo a similar condition, and that's basically where the testicles stop producing as much testosterone as they used to. Common signs of low testosterone are what most men think of, which is decreased libido and problems with erection. But what a lot of men don't realize is decreased energy level, decreased stamina, decreased exercise tolerance, decreased muscle mass, decreased bone density are also common signs or associated with low testosterone. Testosterone is diagnosed by simple blood tests. We don't just check those levels randomly. We usually check them when someone is having symptoms. We treat only patients that are displaying signs or symptoms of low testosterone. I tell them there are a lot of benefits to replacing their testosterone, typically an improved concentration ability, an improved mood, improved erections, improved libido. Two main risks associated with replacing testosterone. The first is prostate cancer. Testosterone doesn't give you prostate cancer, but if you have prostate cancer, testosterone can wake it up. Testosterone stimulates the bone marrow and can thicken the blood, but with too much red blood cells and blood that's too thick, we start to worry about blood clots. There are three main ways to give testosterone. It comes in a gel form, typically in a packet or a tube, almost like a ketchup packet. A man has to rub that into his skin, and that's absorbed transdermally. There's testosterone injections. Those are done typically in the doctor's office every 2 to 3 weeks. And then there's a newer procedure that we've been doing for the last 2 years, and that's called Testopel. That involves the implantation of testosterone pellets. Each pellet is about the size of a grain of rice. Those are put in the fleshy part of the buttock, and those dissolve slowly over the next 3.5 to 4 months. I've had many patients that thought many of their symptoms were just because of aging. We replaced their testosterone, and now they're living much better, fuller lives with their hormones at appropriate levels.
Recommend testosterone replacement therapy. He can be offered a choice between a renewed attainment and weight reduction and testosterone treatment. If Martin states that lifestyle efforts will continue, but that his reduction in sexual desire and pleasure is meaningful to him and his spouse, then testosterone replacement therapy can be initiated with a target serum testosterone level of 500 nanograms per deciliter and a 6-month time limit to show a reduction in symptoms. Martin should have regularly scheduled testing for adverse events. A decision on whether to continue treatment can be made at 6 months.
Well, a growing number of men, middle-aged and beyond, are turning to a hormone produced in the body to treat issues ranging from weight gain to low sex drive. Several new studies document the effectiveness of testosterone replacement, but some doctors point out questions remain.
Dr. Karen Power says the therapy she's used to treat scores of patients has also had a profound effect on her own family. Her husband Oliver had gained weight and was increasingly tired. She says a blood test revealed lowered testosterone levels.
Typically symptoms of low testosterone would be fatigue, low mood, depression, poor sleep, aches and pains.
Dr. Power began treating Oliver with regular injections of testosterone replacement. She says the drug is chemically identical to the hormone that's produced in the body, which can drop off as men age. She says the doses used to bring a patient back up to normal are far different than the doses commonly associated with sports like bodybuilding.
So there are huge differences between maintaining, doing this as a proactive preventative medicine program and doing it for bodybuilding.
Testosterone replacement has been the focus of several recent studies, one of the latest by Bayer Pharmaceuticals in Germany, which markets a testosterone product, found that middle-aged and older men suffering from obesity lost an average of 35 pounds over 5 years. Researchers believe testosterone replacement boosts the body's ability to build muscle, encouraging exercise.
I probably exercised more, I had more energy to do so, but I lost about 25 pounds in 6 months.
Prescriptions for testosterone replacement have more than doubled in the last 5 years, as have the indications for its use. Patient Ashley Tucker says his symptoms were closer to depression.
It's like dismal. I mean, no energy.
He says the injections helped him return to martial arts training. While testosterone replacement has documented benefits, some doctors are cautious about future downsides that could develop, especially for patients who may stay on the drug for decades. Dr. Paul Turek is a urologist in San Francisco who also prescribes testosterone in specific cases.
The rigorous data that you need to really establish a field, the good hard data, is not in yet.
Ongoing research will likely focus on long-term cancer and heart disease risks, but given the current demand among aging baby boomers, several companies are already offering new testosterone-based drugs, and some analysts have predicted that prescription sales could triple to more than $5 billion a year, putting testosterone replacement in the financial league of Viagra.
Testosterone, I have to say, it's kind of an elixir. If taken in the right way, it improves quality of life. It has a lot of effects on a lot of the body. It's like putting premium fuel in the body.
There are a lot of men now on testosterone for these general health optimization reasons, and one of the most rapidly growing fields of medicine. How are you doing?
Recommend against testosterone replacement therapy. To address Martin's symptoms, I would recommend diet exercise at a more vigorous level than recreational tennis and reduce calorie intake. If he loses weight, his serum testosterone level might increase. These changes are more likely than a brew of tea. To improve his cardiovascular fitness, sense of well-being, and overall sexual function.
Hi, this is Mike Vespasian with your testosterone news updates. We all want to increase our testosterone, and a lot of us turn to synthetic methods of doing it, like pro-hormones, hormone replacement therapy, testosterone patches and creams, and even steroid injections. Now, these are synthetic methods that introduce exogenous testosterone into your system, and there are more natural ways of increasing it, so I'm going to list 6 of them for you. The first is the Mediterranean diet. Now, studies show that the Mediterranean diet increases testosterone and boosts erection strength. It consists of nuts, whole grains, fruits, extra virgin olive oil, red wine, fats, and vegetables. Now, it also has a lot of healthy fat, like polyunsaturated fat and monosaturated fat, which are both correlated with high levels of testosterone. It also includes side benefits, like decreasing the risk of cancer and heart conditions. And in fact, the Mediterranean diet is the only diet that has been clinically shown to do so. The second thing you could do is increase the amount of garlic in your diet. Now, you could supplement with garlic, which comes in an extract in pills, or you could just add more garlic or garlic sauce to your food. Now, garlic contains a chemical called diallyl disulfide, which you could help me pronounce. Leave your comments below. And studies indicate that it increases testicular weight and testosterone levels. The third thing you could do is eat more beans. Beans are high in zinc content, and zinc is correlated with high testosterone and low estrogen. And the reason for this is that zinc inhibits aromatase. Aromatase is an enzyme that converts testosterone into estrogen. So by eating more zinc, you could prevent this conversion from happening and increase the amount of testosterone while decreasing the amount of estrogen in your blood. The fourth thing you could do is increase your vitamin A intake. And you could get vitamin A from carrots, sweet potatoes, squash, cantaloupe, and eggs. And there's a study on late onset puberty that shows that increasing your vitamin A intake will actually cause increases in testosterone. The fifth thing you could do is eat more beef. Now, beef has many components that positively impact testosterone, like zinc, saturated fat, iron, protein, and magnesium. But with beef, you have to be careful not to exceed your cholesterol limit. Vitamin D is the sixth thing you could do. Now, you could increase your vitamin D by buying supplements. They're relatively cheap. And high levels of vitamin D are closely correlated with a high level of testosterone. So in Tim Ferriss's 4-Hour Body, he recommends up to 10,000 IU of vitamin D per day in order to boost your testosterone. And you could find vitamin D naturally in sources such as mushrooms, salmon, and milk. So to conclude, follow the Mediterranean diet, eat more garlic, eat more beans, get more vitamin A, eat more beef, and get more vitamin D. This has been Mike Vespasian. Thanks for listening.